All right, everybody, welcome back. You know how we do things here. We
Uh-huh.
pick a topic, we grab some interesting research, and we deep dive. And today, well, today it's all about why you, and more specifically, your liver.
Ooh, the liver. Now, there's an organ that doesn't get enough appreciation, does it?
Seriously, it's like the behind-the-scenes superhero working 24/7, no complaints. But what happens when the superhero gets a little tired? Or
Uh,
maybe he sends up a flare signal. That's what we're looking at today. We're going to get that cheat sheet, the liver whisperer 101, so you can understand what your liver might be trying to tell you.
I like that because our bodies, they try to talk to us, right? It's just learning the language and the liver. Well, it's a
Oh,
subtle speaker.
oh, absolutely subtle. So
Yeah.
before we get into the symptom stuff, got to set the stage. Remind everyone, what is the liver doing all day that's so important?
Oh, where do we even begin? Filtering your blood, for one, like a giant, super efficient Brita filter.
Right, getting rid of all that junk. Then there's producing bile,
Mm.
essential for digestion, right?
Yep. Breaks down fats, help us absorb all the good stuff from our food.
And the liver's busy storing vitamins, converting glucose to energy. I mean, the list goes on. No wonder it gets tired sometimes.
Exactly. And when it does, that's when the signals start. And they can be all over the place: digestion, your skin, energy levels, you name it. The liver's probably involved somehow.
That's what's so wild to me. So let's break it down, category by category. And let's start with digestion. What's a sign? Something people might not realize is connected to their liver.
Everyone always jumps to pain, right? Liver problems, gotta be pain. And yeah, pain in the upper right abdomen, that can definitely be a sign. But honestly, there are often clues before that, even in the bathroom.
Oh, okay. Now you've got my attention. What are we talking about here?
Think about your stool. Color changes, especially if it gets pale, clay-colored, that can be an early warning sign.
Wait, seriously. So it's not just about how often you go, but what it looks like. Huh. Learn something new every day. Why would the color change, though? What's that got to do with the liver?
It's all about bile. Bile is made by the liver, helps break down fats, and it actually gives stool that normal brown color. If the liver's not working right, bile flow gets messed up, and bam, lighter stools.
Oh, wow. That's fascinating. Makes total sense, though.
Hmm.
Okay, what about appetite? I've definitely had times where I'm just not hungry. Could that be the liver talking too?
Absolutely. Remember, the liver is a metabolism machine. It controls how your body uses energy. So a wonky liver can mess with your appetite. You might not feel hungry, even lose weight without trying. Or, on the flip side, some people experience sudden weight gain.
Wow, so those times when you're either starving or can't even look at food might be worth considering the liver, huh? This is blowing my mind. All right, next category, skin changes. Now, everyone knows about jaundice, right? Yellowing of the skin and eyes, classic liver problem.
Yeah, jaundice is a big one, but honestly, by the time someone's visibly yellow, there's probably been some signals beforehand.
Really, what should we be looking for?
So, jaundice happens because of bilirubin. It's a pigment that's supposed to be processed by the liver. But if the liver's not doing its job, bilirubin builds up and it stains the skin and eyes yellow. Early on, it might be subtle, so check the whites of your eyes. If they look a bit yellow, that's a sign.
Noted. Checking my eyeballs from now on. But speaking of skin, what about those tiny spider veins some people get? Those are connected to the liver too.
Yeah, sometimes spider veins can point to circulation problems, and guess what? The liver plays a role in blood flow and clotting too.
Oh, of course. It's all connected.
Right. It's like, imagine your liver as a washing machine for your blood. Keeps it clean, flowing smoothly, but if it's overworked, things get grungy, circulation gets sluggish, and spider veins can pop up.
Okay, that's an image I won't forget. Washing machine liver. Got to keep it running smoothly.
Mhm.
Speaking of inside, let's talk about the abdomen. We mentioned pain, but you said location matters, right?
Huge. It's not just any tummy ache, it's specifically pain or discomfort in the upper right abdomen, that's the liver zone. Could mean swelling, inflammation, all sorts of things the liver doesn't like.
Got it. Upper right, not just general grumbling. And we talked about weight changes being a clue. Anything else to watch out for in that area?
Oh, for sure. Bloating, especially if it's constant and you haven't changed your diet, that's worth noting. It's like your body's saying, hey, something's up down here.
Okay, so any weirdness, discomfort,
Hmm.
changes in that upper right abdomen, doctor visit time. All right, now the big one that I think we can all relate to, fatigue.
Hmm.
Everyone's tired these days. How do we know if it's just life fatigue or something more serious, maybe liver related?
That's the tricky part. Regular fatigue, you get a good night's sleep, you feel better, right? But liver fatigue, it's like no matter how much you rest, you're still wiped out. And what's really scary is if that fatigue comes with confusion, trouble focusing, like brain fog.
Wait, so it's more than just feeling sleepy. Why would the liver affect our brains like that?
Yeah. Because the liver's not just about digestion. Remember, it filters toxins. And if it's not filtering properly, those toxins can build up, and guess where they love to go? The brain. It's called hepatic encephalopathy, basically toxin overload affecting brain function.
Oh man, that sounds awful. So you might feel confused, forgetful, even your personality could change a bit. It's like the liver saying, hey, I need help. This is affecting everything.
Exactly. And that's when it's really important to see a doctor ASAP, where early detection is key for liver problems, so don't ignore those mental changes along with the fatigue.
All right, so we've covered the symptoms, but let's talk causes. What actually damages the liver in the first place?
Well, the big one everyone knows is alcohol, right?
Hmm,
Over time, too much alcohol, it's like poison to liver cells, leads to all sorts of
makes
problems.
sense. What else?
There's viral hepatitis. That's an infection that attacks the liver directly. We also see a lot of fatty liver disease these days, often linked to obesity and diabetes. It's basically fat builds up in the liver, starts messing with its function.
Oh, right. So our lifestyle choices really do matter for liver health, huh? Oh, and what about cirrhosis? I hear that word sometimes. What exactly is that?
Cirrhosis is basically scarring of the liver. It can happen from lots of things: alcohol abuse over time, chronic hepatitis, even fatty liver disease can lead to it. And the problem is, cirrhosis can cause even worse things: liver failure, even liver cancer.
Okay, this is all getting a bit heavy, but important stuff to know. And I got to emphasize, this is not about self-diagnosing, right? This is about knowing the signs so you can talk to your doctor intelligently.
100%. You know your body best. If you're experiencing any of this stuff, especially several symptoms together and it's not going away, don't wait. Go see a doctor. Early detection makes all the difference.
So true. You're your own best health advocate.
Absolutely.
Okay, we covered a lot today. The liver, what it does, how it talks to us, what can go wrong. So what does it all mean for you listening right now? Think about your habits, your health. Are there any little changes you can make this week to show your liver some love?
It's about small steps, right? Being mindful of what we eat, how much we drink, managing stress, it all adds up.
Exactly. Our liver's working hard for us. Let's try to work with it. Yeah, the liver's tough, but it's not invincible. So until next time, everybody, stay curious and take good care of that amazing liver of yours.
Cheers to healthy livers.